Hi there, everybody. Today is the end of day 2, and we've seen lots and lots of stuff. You can see we're back at our Airbnb, and I'm already in comfy clothes. I'm wearing red because of arthritis colors, so I just wanted to kind of preface that for everybody. So, the debrief I'm doing today is specifically on menopause in rheumatic diseases. So, you're going to see me looking over to the left here. Oh, my left. I don't know what's going to look like for you guys. But my computer's sitting over here with slides that I wanted to specifically talk about. So, you can take a peek and just, again, apologize for my eye contact being over there, but it's the best way so you guys can hear everything that I learned today. So today, the first part of the menopause section had 2 parts. So the first one was transitioning through menopause, implications for patients with RMDs, and the speaker was Sharon Parrish. She's from Weill, Cornell Medical College. Not sure where that is, but she did a fabulous job. So the learning objectives of this particular piece was recognizing common perimenopause and menopause symptoms in patients with rheumatic diseases, and including those which that have a little bit of a differential. So they speak more about the flares that we have and things like that. And also talking about the psychological changes that we all have during that time, because there are many. I've been through it, so I know. Then we move on to the symptoms of menopause. The typical things that we always talk about are changes in our menstrual cycle. There's the hot flashes, sleep problems, big mood disturbances, and depression that can go with it. Vaginal health and sexuality that can have some issues. Bladder control and infections leading to more incontinence and things like that. Weight gain and joint pain, of course. One thing she's focused in on are called vasomotor symptoms, and it affects 50 to 82% of women at some point during their menopause transition. And it talked about ethnic and racial differences in the Black, Hispanic, white, Chinese, and Japanese women. When it talked about hot flashes, what occurred during the day, there's the night sweats, which happen at night. Common sense as far as that goes. And it talked about sometimes you can even be sweating so much that all of a sudden you get the chills because air is hitting you and you're soaking wet, your hair's wet and things like that. So you can actually even get chills that are associated with that. Heart palpitations. And let's see, just different things. So it talked about also the menopausal excuse me, I'm tired, symptoms and the burden of those other symptoms. So the primary ones that we talked about were the primary one that was number 1 issue was sleep. Next one was self-care. Next one was work. And the next one was your mood and your emotions being all over the place. And they also talked about hot flashes being another one of the number 1 symptoms that had a huge burden on folks. Premature menopause. So that is talking about, they actually did a study that talked about the primary ovarian insufficiency before the age of 40. So that's very young for menopause to actually start for any woman. And it talked about just all the different things that can happen with that, with adverse long-term health consequences, coronary heart disease, osteoporosis, mood disorders, and elevated risk of genital urinary system. So all of the urinary tract infections that we can get, as well as dryness and things like that. So that was definitely talked about, and just it made me feel better, because again, I've been through so much of this that I wish I would have known this information ahead of time. Let's see. They talked about risk factors for a lot of these symptoms that we were talking about: obesity, smoking, low socioeconomic position, high fat and high sugar diets. None of the things we want to talk about, right? Medical comorbidities, etc. So menopause and lupus. They talked about the mean age that menopause tends to happen is 46 years. So roughly into your 46th birthday. And they said it happens, there tends to be a little bit more of a risk of early menopause in lupus patients. There was, let's see, they also said that after menopause that your symptoms for lupus may improve. So that's a highlight. So again, nobody wants to go through this, but we all have to pick and choose what we're looking forward to. Let's see, menopause and rheumatoid arthritis. They do say that there tends to be a lot of inconclusive data, so they're not exactly sure at this point as far as the effect on and the severity and onset. They also mentioned that there's not a lot of studies on menopause. And definitely when I was going through it, my symptoms increased and were exacerbated significantly. Not that's going to happen to everybody, but that's my own experience. And I'm only 55. Let's see, extreme excess bone loss is seen in RA, and increased osteoporosis that they talked about. Managing the symptoms. So it's funny, they talked about addressing the hot flashes with hormone and lifestyle interventions, diet, exercise, supplements. It depends on if it's counterintuitive for you to actually go on to estrogen. They talked about sleep disturbances and all of those kind of things. And also just really the sexual function. So having sex gets more difficult. So there are things you can actually do, which I'll get into, that can actually help your symptoms. So comprehensive care so after menopause is finished, is lifestyle organization, dealing with your nutrition, taking a good look, physical exercising, reducing alcohol consumption, and not smoking. Let's see. There are some non-hormonal therapies to deal with some of these symptoms. And they talked about I might say this wrong, paroxetine, which is a low dose mesylate salt, which is FDA approved. There's a kinin B antagonist, which also is FDA approved and should help with symptoms. Other off-label things are like serotonin and gabapentin, which some of you might have heard of. And as far as dealing with some of the issues with the urogenital areas, using moisturizers, lubricant, and be alert as far as if you're not having sex quite so often, then you might want to lean more on these type of things. They talked about using actual lidocaine in your vagina so it doesn't hurt so bad because of the other things that we were talking about. Look into actual different positions so it actually is more comfortable for the woman. And also talking about go to additional counseling for things like talking to counseling about your fatigue and things that really are bothering you, and having really good communication with your doctor. The key points, again, is some of the things I talked about, all the different indications and the pain, sleep difficulties and things like that. For lupus patients, they may be influenced by your menopause status. So whether you're feeling better or not feeling so good, there's definite things that lead to that. The osteoporosis in rheumatic diseases and bone fragility. So definitely keep an eye on all of those things. Second section was related to menopause, treatment options, and safety considerations. And it was a doctor from Weill Cornell Medicine. And she talked a lot about the risk assessment of cardiovascular disease and breast cancer. So depending on your breast health and cancer status, if there's anything going on, they definitely have done some studies leading to just looking into women that are at risk for cardiovascular disease or breast cancer. And it was definitely conclusive that you just need to follow what your doctor's telling you. Let's see. There was a piece that was done on 351 menopausal patients that either had inactive disease or active disease. And it talked about, this is for lupus patients, and looking into the symptoms and using estrogen versus a medication. And it definitely showed that the group with the hormone therapy did better. So if you're able to take hormones, that actually helped in this situation. Let's see, this one, and this last study was specific to short-term hormone therapy, and it definitely was associated with helping decrease the flares in people with the rheumatic diseases, and this is specific to lupus and RA. So those are the things and some of the takeaways I had. Again, I've been through most of this, so I totally understand that it is a really significant topic for us. And again, me being 55, I had a hysterectomy, had my ovaries left, then had one ovary taken out, and because it was very cystic and it was problematic. So then after that, I went into horrible hot flashes, at least 20 a day, that were like hair soaking, clothes soaking, and I had to change my clothes at least 5 times a day. So not a fun period to go through. But with hormone therapy for myself, it has actually helped significantly and really held off a lot of the other symptoms that they were talking about. So definitely happy to be here and ask questions if you haven't.